Right now, in America, we face several problems. Money has become a financial vortex. We have a growing population to care for. We have a shrinking physician workforce. There is frustration with healthcare. There's even an exodus of some physicians. If we don't find solutions to these problems, our healthcare system could be crippled beyond repair. AAMC Chief Public Policy Officer Dr. Atul Grover explains further.
There's a doctor shortage that's worsening. In the next decade, with our growing, aging population and more Americans with health insurance, there just won't be enough doctors to go around. And it's a shortage of all kinds of doctors. Primary care, surgeons, oncologists, specialists who treat kids. This isn't really a surprise to the nation's medical schools. 10 years ago, experts saw this shortage coming. 90,000 by the year 2020. America's medical schools were...
Additionally, Cal Poly professor Jenny Olmstead, a certified personal trainer and strength and conditioning specialist both at the university and with outpatient PT clinics, and a volunteer for nonprofit organizations to serve individuals information about their healthcare, discusses this issue.
The issue with the smaller workforce is significant, and I feel that it's significant in the immediate as in the long term. We have already hit the baby boomers turning 65. The number of individuals over the age of 65 has already expanded significantly and continues to grow. Their healthcare needs are much more expansive than younger demographics, and we've already been in that since the early 2000s. So that on top of greater access, given some of the change in the legislation, makes it an immediate need. People are being denied coverage, are not having access just purely based on the number of qualified professionals or professionals that provide a level of care at the cost that they can afford.
The reality is, we have more people who are needing healthcare and less physicians entering the workforce who are licensed and ready to provide that care. This is the shortage. We know this, we see this, we feel this. The United States is in a state of emergency. These issues are real, and they are present. If we do nothing, our nation will experience a sickness we are incapable of curing. Solutions are needed. It's not as simple as walking through the doors and receiving care anymore, and you certainly don't want to be in an ambulance experiencing this shortage.
In 1997, Congress passed the Balanced Budget Act in an effort to reduce the deficit by freezing or cutting spending. One thing this act froze was funding for graduate medical education, GME, or residencies, capping residency slots at 1997 levels. This is the bottleneck we face. Medical schools can and have graduated more doctors, but until Congress votes to lift that cap, it won't mean one single additional physician to take care of you, your friends, your family, and neighbors.
In the next 10 years, we see our supply for physicians at approximately 745,000, but our demand hovers at 898,000. At this rate, it just isn't enough.
We also have the issue for nurse practitioners, PAs, primary care physicians. The length of time for adequate training is still within this. We're going to be training people now that will be professionals in 8 to 10 years. And so I think the urgency is significant that something has to be done now. Otherwise, even in 10 years, we're going to be far worse off than we are with the access to that skill set, to that level of professionalism.
One proposed solution is to expand the roles of other professionals in the health field by giving them more responsibilities. That way, we alleviate some of the need for primary care physicians. Now, let's hear from Professor Olmstead about the direction of our future.
Where we go from here, I think, is not solely the responsibility of any one entity. It's not solely the responsibility of the government or a change in laws or university systems or students and families themselves to be able to support an education that is drastically increasing in cost every year. So I don't see it as any one responsibility. I feel very strongly, though, that all of those entities or those organizations, the level within the government, within private industry, within the healthcare insurance agencies that we have, and within the individuals who will be practicing providers, I think all have some role in that. I would definitely say what the right solution is. There's going to be those varying opinions on that, but I do feel strongly that it's going to take everyone to compromise and to invest, whether it's personnel, whether it's financial resources, whether it's change in legislation, laws, whether it's supportive programs. I think it's going to require significant investment from all of those interests. I don't think we have a choice, and I think that, again, we saw it with the baby boomers. A decade before they all turned 65, it was like, we have a huge issue. We need to solve it. And they all turned 65.
We are the United States of America. We used to have some of the best health care available to our citizens. That just isn't the case anymore. Our action must be prompt, and it must be swift. Both Congress and the House have proposed legislation to combat the freeze on graduate medical education. The first of these is the Training Tomorrow's Doctors Today Act in the House. The second is the Resident Physician Shortage Reduction Act of 2013 in the Senate. Both pieces of legislation aim to phase in 15,000 Medicare-supported residency positions over the course of 5 years. The new laws would distribute these new residency positions based on priorities, such as emphasis on training in community or outpatient settings and location in states with new medical schools or new branch campuses. In effect, these laws will increase the number of medical school graduates who will receive hands-on training in a patient setting to gain the experience needed to become a practicing physician. Now we'll hear more from Professor Olmsted about Covered California.
Covered California is focusing on providing access through not only service but then financial subsidies for individuals of varying socioeconomic or income levels. The goal is that there are exchange systems within insurance agencies that are not operating in an isolated industry any longer. They are working within the government system to provide additional care or additional coverage to those who are either uninsured or underinsured. Specifically in California, enrollment for these programs started in October. They went into effect January 1st, and enrollment has provided options for individuals, again, primarily based on number per family and then the income of those families. Issues with Covered California from some local physicians have been with, actually many of them are not taking Covered California except in certain situations to maintain certain patients. So within San Luis Obispo County, I'm hearing more and more from physicians who are saying, I'm either not taking it or I'm only taking it in specific circumstances. So that's problematic. I think it's problematic for individuals who felt that this was going to provide them greater access when more and more physicians are not finding it a reasonable means of being reimbursed for their services. And I think that's a significant issue.
America has a long road ahead of it before we will be ready to fight these symptoms effectively. Let's not miss the signs in front of us and carry on without actively combating these growing concerns. For the sake of our country and the health of our people, we must act swiftly before it is too late.